Hi, this is Szara from Szara Dental Lab. In this video, I'm going to teach you how to make an orthodontic flipper appliance. Subscribe to my channel on YouTube and follow the link below. You can also now follow me on Instagram, where you'll see some other pictures about me, my family and I, and other orthodontic appliances that I make that I can just take a quick picture and load them up. And you'll see some things that I'm not going to show on YouTube, so follow me on Instagram. This is an interesting little trick to make my flipper appliances fit better, is to shave a little bit of the tissue away. As you can see, it's just a little tiny bit. It's going to make a snugger fit. The first thing I'd like to do is remove the cervical of the tooth. The teeth are always made that are super long, and it's not necessary to have this much length on a tooth. It's good when you need it, but on 90% of the teeth you need to remove it. The art of setting a tooth to make that a perfect fit takes time, patience, and a lot of practice. This next step is an important one. I use a fissure burr. What I like to do is cut a keyhole out in the back of the tooth. This allows the acrylic to flow in and make like a locking mechanism. After your tooth is in the right position, I'll apply a little bit of separator on the model. At this point, I'm warming up my base plate wax so I can set the tooth, put a little base plate wax on the mesial and distal of the tooth. I like to use base plate wax because it allows me to make slight adjustments. See, I'm moving it very slightly to get the position of the tooth, the right angles. This is very helpful. If you use sticky wax, which is great for locking the tooth in, but you can't make the adjustment because once you go to move the tooth, the sticky wax will break, and then you have to reset the tooth every time, which can be extremely frustrating. Next step is to use monomer and a tooth shade acrylic. This is going to give you a real nice look and build up your tooth. I let the monomer and polymer soak into the tooth. This way it goes onto the fascia side and gets rid of any gaps. Without allowing the monomer and polymer to flow tooth, you will have gaps, which can look awfully terrible. On the fascia side, you can see where the monomer and polymer kind of snuck underneath the tooth, and I'll make just a little bit of adjustment to remove as much as possible, basically to make it a nice snug fit and have less work to do when finishing. The final step is to add monomer and polymer and finish your flipper appliance. In this particular case, I use ball clasp for extra retention. There's a couple different monomers and polymers to use. Sometimes I'll use a denture acrylic. It makes it look a little more natural for patients that are a little bit older who think that they're wearing a denture. In particular, when the kids are younger, I make it more of a clear pink acrylic so it matches their gum line. And it looks more like a retainer, so it's more of a child's appliance rather than an adult. And in the next scene, I'm going to show you the finished product. That's what it looks like when it's all finished, polished. I didn't do a trimming video on this, but I will in another video. For more orthodontic videos, subscribe to my YouTube channel and follow me on Instagram. So follow the links below, and hope to see you in the next orthodontic video. Thanks for watching.